Hi, welcome to Von Gillette's YouTube channel. Today we'll be covering what is anterior pelvic tilt. Anterior pelvic tilt simply means our pelvis is rotating anteriorly. And for our purposes, what we're really after is it excessively anteriorly rotating? A small degree of anterior pelvic tilt is probably okay, but you've probably seen those individuals that it looks like they're trying to stick their butt out. And in reality, that's just the way they hold themselves up. Now, the problem with excessive anterior pelvic tilt is it can cause low back pain, hip pain, knee problems, shoulder problems, or neck problems. So how we're going to address this is we're going to do assessments in how you stand. We're going to put you under a load to see how your plank is, how you squat. We're even going to check for how you walk, and we're going to make sure that the postures that probably originally cause anterior pelvic tilt, like your sitting posture, your standing posture, even lying down, are optimal so you can get out of excessive anterior pelvic tilt. Okay, the muscles that are primarily responsible for causing anterior pelvic tilt are going to be your hip flexors and your erector spinae muscles. These muscles are either too short, too stiff, too strong, and they're just plain dominant. All right? The hip flexors attach from the femur onto the front of the pelvis. They pull that front of the pelvis down or anteriorly. The erector spinae muscles attach from the pelvis to the ribs above. They pull the back of that pelvis up or anteriorly. Now, the muscles that we want to turn on are going to be the abdominals. They attach from the ribs to the pelvis. They pull the front of that pelvis up and hopefully into a neutral pelvic position, which is really what we're after. The other muscles that will get us out of excessive anterior pelvic tilt are the glutes and the hamstrings. They attach from the pelvis to the ribs above, from the femur to the pelvis. They pull us back, again, hopefully into a neutral pelvic position. How we train these muscles is critically important. If you're not training already and setting yourself up in hopefully a neutral pelvic position and training these muscles, you may not get the best out of how you train these muscles. So what we'll be covering in the future are assessments, treatments, positioning, types of exercises that are going to help you get out of excessive anterior pelvic tilt. If you have any questions or comments, please post them below. Thank you.